Hi, I'm Dr. Mike Roberts with Wisconsin Orthopedic Physical Therapy in Wauwatosa, Wisconsin. I'm here today with Tyler Sullivan, owner of Badger CrossFit, also in Wauwatosa. Today we want to go over a common condition we've been seeing lately with rotator cuff and labral issues in the shoulder, and discuss ways you can prevent these injuries from occurring, and if they do occur, what you can do to help with the symptoms. Now, a lot of athletes and CrossFitters ask me, what do I do if I all of a sudden do have pain in my shoulder? Typically what I like my patients to do is give it 2 days of rest. Usually these injuries of any type of rotator cuff or labral injury starts as kind of a nagging ache that most patients want to kind of push through. I recommend that you take 2 days off, ice it at least twice a day, and then personally I like my patients getting their inflammation down by taking a leave at least once in the morning and then 12 hours later if needed.
In CrossFit, there are 3 main components to a healthy shoulder: stability, strength, and mobility.
And within stabilization of the shoulder joint, especially the scapula or the shoulder blade, there are 3 components with that. One is a posterior tilt of the shoulder blade, depression, as well as upward rotation, which we'll go over here soon and give you some demonstrations.
Now, going off of the 3 movements of the shoulder blade, it's important to keep all 3 of these in mind when performing any type of CrossFit movement, but especially on the movements that are as extreme as an exercise such as a kipping pull-up. Now, although there is any research currently in CrossFit, there are a few studies out there that looked at elite gymnasts and the amount of stress placed in those shoulders with these types of movements. Now, 2 of the studies looked at a long swing movement within the rings and found that there's actually anywhere from 4.5 to almost 8 times a person's body weight placed within that shoulder. Now, another biomechanical study looked at these elite gymnasts and found that improper timing and muscle activation did lead to slap tears in these athletes.
So going off of the studies that I had just talked about regarding kipping pull-ups or even a strict pull-up, we want to maintain those 3 components I discussed earlier at the shoulder blade. Now, what I'm going to have Tyler do here is we're going to go over the 3, and with any kipping or strict pull-up, we have to maintain that active ready position. So I'm going to have Tyler go ahead. Now, instead of this position, we want him to go down and back right there. That's your active ready position, where he's kicking in that posterior tilt of the shoulder blade. He's maintaining depression and also upward rotation. Now, what I'm going to have him do here is go ahead and do that same position up on the pull-up bar and doing a strict pull-up. Now he's maintaining that. He's avoiding his body falling down, going into that shrug position. And go ahead. And then as he comes back down, he doesn't let the shoulder blade go into the shrug position. He's maintaining that active position, just like that. Starting with shoulder mobility, there's 3 assessments I like to use to assess all planes and axes of the shoulder joint, and we'll go over them here.
Now we're going to go over the 3 assessments with Adam here. First one being, he's going to reach up above his head, and he's going to reach and try and touch those thumbs and hands to the floor, all right, without compensation here in the spine. We're looking for his hands to touch the floor and ensure that he's flat and comfortable. All right, that's the first assessment. Second assessment being elbows out to the side. He's going to externally rotate and put his hands directly above his elbow joint. Okay. Now, see, he's lacking the external rotation of the shoulder, which is going to lead to compensations and thus injury in the future. So he's needing to work the external rotation of that joint. All right. The other assessment. Go ahead and stand up. Is he's going to turn around. All right. He's going to try and he's going to bring one hand up between his shoulder blades, all right, and he's going to take his other hand on top, and he's going to try and interconnect his fingers together and touch that. And then we're going to measure this distance. You can see that he has really good positioning.
So based on the 3 mobility assessments we just went over, there are 3 mobility exercises that we can do if limitations are noted. The first one, where we had the hands go over the head, if there are limitations there, I like performing this exercise with my CrossFit patients. So with hands on the box here, Adam is going to go ahead and go all the way down. He's going to feel a nice gentle stretch in the shoulder joint. Now with this, it should be pain-free, and it should actually be a comfortable stretch for the patient. With this, I like my patients doing 3 holds of 30 seconds. And after 30, he'll come back up, give it a quick rest, and then when he's ready, he'll head back down. So that's if there's limitations with going overhead. Now the second assessment we went over was looking at external rotation, where you're lying on your back, coming into external rotation. Now with that, there are a few different ways we can do this. The first one, I know a lot of gyms use dowels here. Let's have you hold this. Is going to be bringing this right here. You're going to go into external rotation, and he's going to use the left hand here and try to bring this up a little bit right there. He's going to use that left hand to slowly turn his right shoulder into external rotation. Now with this, again, it should be a nice gentle stretch. There shouldn't be any pain with it. Now for my patients that are severely limited with external rotation, this does provide room for some compensation. So what I like to do is have my patients lie on the ground here. And again, like Adam we saw here had limitations with the left shoulder, he's going to use this left hand holding the dowel or PVC pipe, grabbing onto there and pushing down into that final 5 to 10 degrees of external rotation. Again, this should be pain-free and feel like a comfortable stretch. And as with the first exercise, I like 3 holds of 30 seconds. And last but not least, the exercise where we were looking at internal rotation with hands behind the back, and again doing it on both sides assessing, is going to have Adam lie on his side here facing this way. He's going to bring his bottom shoulder right out there, and then using the opposite hand he's going to grab his wrist and pull straight down. Again, like the 2 stretches we went over before, I like a comfortable stretch. It should be pain-free. And I ask my patients not to push to where it's a high intensity of a stretch. Again, 3 holds of 30 seconds. First exercise I have here is what I call a prone scapular hold, and personally one of my favorites when it comes to the shoulder. Now what I'm going to have Tyler do here is going to bring his arm right out to the side. He's going to be at 90 degrees of abduction, 90 degrees of elbow flexion. And again, those 3 components that we were talking about earlier, we want to kick that shoulder blade down and in, just like that. Now you saw he was up higher here at the beginning, kicking those muscles in down at the lower part of the shoulder blade and maintaining that. Now I'm going to have him hold here for about 30 seconds. And throughout the 30 seconds, what's going to happen here is gravity is going to want to pull his arm down. It's going to want to start to fall this way. What we want to do is fight that, kick in those external rotators, and maintain the arm parallel with the floor. Again, at that same time, avoiding upper trap activation, just like that, kicking in those lower trap muscles. Next exercise I like to do here is called the push-up plus. Now what we're going to do here is activate a muscle called the serratus anterior. Now the serratus anterior starts right at the inferior angle of that shoulder blade and comes right along into the ribs. So almost like finger-like projections that come along right there. Now what we're going to do here is Tyler's going to come all the way out in a full plank position. He's going to lock out the elbows and he's going to let his body fall in and let his shoulder blades fall in together. From there he's going to push all the way out, pull there, and then back down. I'm going to have him do a set of 15. And the main action of the serratus anterior is that one component where we talked about upward rotation of the scapula. If you can build up strength of this muscle and stability, you improve the mechanics of the shoulder blade. Perfect. The next exercise here works on both external rotation strength as well as scapular mobility, which we've been discussing the entire time here. So what I have Tyler do with a TheraBand or any type of band, holding with the palms up, what he's going to do is he's going to go into external rotation, and at the same time, and the entire time, keeping the shoulder blades in those 3 scapular positionings with posterior tilt, upward rotation, as well as depression, and keeping the upper traps here deactivated. With this, I like 2 sets of 15. When he brings it out, he can hold for a split second and then slow on the way back in. Also important with this one is as he comes back in with the band, he's not letting the shoulder blade pop out. He's maintaining that position the entire time.
For more information of Wisconsin Orthopedic Physical Therapy and Badger CrossFit, please feel free to contact us or visit our website.